These pediatric grand rounds are in recognition of the National Indigenous Peoples Day, June 21st. As Sheila mentioned, I think Jordan's principle is extremely important for us to understand, both the history, the context, but also the practical application and how it can ensure or help ensure appropriate patient care for many of our patients. So I think it's an extremely topical, interesting, and important topic. So very much looking forward to your presentation. I found the website very helpful, and for anyone who's not visited the website of the First Nations Child and Family Caring Society, I think it's an important one for all us to know about and to be able to refer to, as needed. Sheila, thanks for acknowledging the land that we are on, and I'll introduce Brittany. Brittany is a Michif and a member of the Métis Nation of Alberta. She has been working in the areas of public education and policy in support of Indigenous children, young people, and women's rights for 8 years through both professional and community organizing paths. Brittany has an Honours Bachelor of Arts in Indigenous Studies and a minor in Conflict Studies and Human Rights from the University of Ottawa. And she'll be speaking to us today about Jordan's principle, a sacred responsibility. So thanks again, and over to you, Brittany.
Wonderful. Thank you so much for that great introduction. And you know what? I'm just going to hop right to, because I know you guys are busy. Okay. So I welcome questions throughout, but also feel free to reserve them to the end as well. So Jordan's principle, what are we talking about when we talk about Jordan's principle? So Jordan's principle is in fact a legal rule. It's not a program, policy, initiative, or anything else like this. It's named in memory of Jordan River Anderson from Norway House Cree Nation. And he was a little boy born in a Winnipeg hospital with some pretty complex medical needs, such that he had to live in the hospital. But at some point, his doctors said that he could actually go and live in a medically assisted foster home in Winnipeg. His family placed a request to asked, the government, hey, we want him to live in a home. And unfortunately, because he was First Nations, the province of Manitoba and the government of Canada actually fought over who was going to pay for his at-home care. And it was very much over like very trivial things like a $30 shower head, right? And unfortunately, what ends up happening with that is he spent more than 2 years unnecessarily in the hospital, and then unfortunately passed away at the age of 5, having never lived in a family home. And so after he passed, his family, and that's the picture on the bottom there, his dad is Ernest. His family gifted his name to the creation of Jordan's principle. And we certainly view that as a sacred gift. And that's part of the reason why we say it's a sacred responsibility, because we are talking about a little boy here who passed away, never having, benefited from at-home care or family home care of the family. And Jordan's principle ensures that all First Nations kids can access all services they need when they need them, right? And because it's sacred, and because we're talking about a little boy, we asked for folks not to use the acronym JP, because this really reduces Jordan's principle to the level of a government policy or a technical term, and it really dehumanizes Jordan's legacy. So we really ask folks to use the full word. So this is a very brief, high-level timeline of Jordan's principle. So after Jordan passed away in the hospital in 2005, his family gifted his name to the creation of Jordan's principle. It actually passed unanimously in the House of Commons via private member's motion in 2007. And shortly thereafter, a human rights complaint was filed at the tribunal because Canada had failed to implement Jordan's principle. And then Canada did actually begin sort of implementing Jordan's principle, but they implemented it in such a way that the definition scope was so narrow that no child actually was benefited from Jordan's principle or was found to be eligible for Jordan's principle. And in fact, I don't think Jordan River Anderson himself would have been eligible for Jordan's principle in the initial years. 2016, the government is found to be discriminating against First Nations kids. And up till now, there has been 28 procedural non-compliance orders against the government to try to get them to comply with the tribunal orders and end its discrimination. But the benefit is that there has been over 4.2 million supports approved for First Nations kids. And that's really a testament to the work of families, advocates, community-based service coordinators, First Nations communities, things like folks like this, who've really made sure that their kids could benefit from these services and get the services that they need when they need them. So one of the initial starts to Jordan's principle was actually in 2005. The federal government paid the Caring Society and some other folks to basically, write a report on the experience of First Nations kids accessing services through child welfare services, through healthcare services, things like this. And these reports found two main things. One, governments were consistently more concerned over who was assuming costs, not the safety and well-being, right? And two, jurisdictional disputes, so like between governments, and in fact also between federal government departments, were significantly impacting the lived experience of First Nations kids, particularly those with complex needs, right? And because of this, they actually recommended in these reports that Jordan's principle be implemented without delay. So the government received these reports, they agreed with the findings, but they shelved the reports and didn't take up the recommendations. So in part because of that choice by the government not to take up the recommendations, the Caring Society and the Assembly of First Nations filed a human rights complaint at the Canadian Human Rights Tribunal in 2007. And the complaint basically alleged that Canada's inequitable child welfare funding for First Nations kids and approach to Jordan's principle was discriminatory. So after much legal wrangling, including the government trying to get the human rights order thrown out on legal technicalities and jurisdictional issues, the tribunal did find in 2016 the government is discriminating against 165,000 First Nations kids and their families by providing flawed and inequitable child welfare services and failing to implement Jordan's principle to ensure equitable access to services. So there's two main pieces from this initial sort of landmark ruling. First, the government wasn't actually able to put forward any evidence to address the discrimination that the co-complainants, being the Caring Society and the Assembly of First Nations, put forward. And secondly, that what the tribunal found was that really, compared to the residential school era, not much had actually changed the lives and the experiences of First Nations kids, right? So they were still experiencing significant depths of discrimination, so on and so forth, right? And this is part of the reason why, for example, in 2015, the Truth and Reconciliation Commission, its top 3 calls to action have to do with reforming the child welfare system and fully implementing Jordan's principle, right? The survivors of the residential school system knew that ensuring equitable access to services and ensuring non-discrimination was key for addressing the legacy of the Truth and Reconciliation Commission, right? Similarly, the National Inquiry into Missing and Murdered Indigenous Women calls for justice, calls for equitable access to basic rights like housing, education, healthcare, things like this, and also the full implementation of Jordan's principle. And the inquiry knew that this was important because ensuring these rights, ensuring this access to services was key and foundational to ensuring the dignity and rights for Indigenous women, girls, and Two-Spirited folks. So that's a very brief summary of some of the reports and some of the inquiries and commissions and all the rest of that have called for accountability for First Nations rights and also remedying the harm against First Nations kids. But in fact, that's just a very brief, recent timeline. for over 100 years, there have been reports that the government of Canada has actually paid for and sought to address, look into the experience of First Nations kids. And many of these reports said, hey, First Nations kids are experiencing harm, and here's how you can make it better. And delivering these reports to the federal government, and then the federal government ultimately choosing to shelve those reports, right? And we see generations of this. And so this is, again, a very brief timeline of some of these reports as early as 1907, when Dr. Peter Henderson Bryce called on the government to ensure that residential schools were safer for kids. So as I said, the tribunal has issued 27 procedural noncompliance orders against the federal government since the January 2016 ruling. These orders were really trying to compel the government to fix its discrimination and ensure it doesn't happen again. And in fact, when the first order came out in 2016, it said, government of Canada, you must fully implement Jordan's principle. Unfortunately, what the government did was immediately start having talks about implementing Jordan's principle. And this is actually very common with the government. So very soon after the 2016 order, the tribunal had to issue another order saying, hey, what we meant was you need to immediately implement Jordan's principle, not immediately have talks to potentially implement Jordan's principle, right? So it's like these sort of orders. So this is sort of the nuts and bolts of how folks and yourselves could access Jordan's principle, right? So it's it ought to be pretty straightforward. It is pretty straightforward. If there's a First Nations child or a group of First Nations kids that you're working with and they need services or supports or products, you call the 24-hour call center, or you can connect with the regional office, Indigenous Services Canada office. There's also community-based and authorized service coordinators throughout Canada. And so all these folks, Indigenous Services Canada and also the community-based folks, try to make sure that families can access Jordan's principle in a fairly accessible way. And really, you only need to provide some basic information, the kid's name, a referral from a professional or elder and knowledge holder, the parent or guardian consent, and then confirmation of eligibility. Things like quotes, cost estimates are not required for Indigenous Services Canada to decide on the request, right? And the tribunal has actually issued very clear timelines when it comes to Canada, Indigenous Service Canada making a decision on requests, right? And so this is on my right, potentially your left. These timelines here, right? And so an urgent request is really any situation where a child could come to irremediable harm if a service or support is not provided, right? So things like no access to basic necessities, risk of child entering the child welfare system, the child is in palliative care or end-of-life care, physical safety concerns, things like this, right? Now, these are some of the additional key elements of Jordan's principle. So Canada's previous definitions were too narrow and thus discriminatory. And in fact, Canada's non-compliance has been linked to the deaths of First Nations kids. It applies to all First Nations kids, both on and off reserve. It applies to all services. So there's sometimes a misconception that it only applies to, for example, healthcare, but in fact, it really applies to like anything a child would need, right? As I said, there's very specific timelines that the government must adhere to determine requests. And government administrative procedures or case conferencing or service navigation cannot be used, right? The tribunal orders are very clear. It's the government or department of first contact must determine the request. And the timeline or the clock starts at initial contact, right? And I'll very briefly go through sort of the eligibility piece, because in fact, it was actually a team at Sick Kids in Toronto. They were working with a First Nations toddler at the time who needed emergency support. And so they had made that the care team and the First Nation and the family had made a request to Jordan's principal for help with this. And Jordan's principal, Indigenous Service Canada, actually denied it because the child wasn't eligible for Indian Act status. Well, the community said, well, the child is like a member of our community, right? They might not be eligible for Indian Act status, but they're a member of our community. And so the Caring Society actually filed a non-compliance motion at the tribunal to compel Canada to say ensure that all First Nations kids could access Jordan's principle. So fast forward about a year and a half, the tribunal clarified that there's basically a four-part criteria, and a child meeting any one of that criteria is eligible for Jordan's principle. So it's essentially any child who's either eligible to be registered or is registered under the Indian Act, right? So if you have a patient that you're working with and they don't have Indian Act status, don't let that be a barrier to accessing Jordan's principle. In some cases, part of the process is Indigenous Services Canada. It's on them to confirm whether or not a child is eligible for Jordan's principle or eligible for status under the Indian Act. But also, if their parent or guardian has Indian Act status or is eligible to be registered for Indian Act status, then the child is eligible for Jordan's principle. If the child is recognized by their nation, then they are eligible, right? And also if the child is ordinarily resident on reserve, right? And for the recognition by their nation, it's specifically for the purpose of Jordan's principle. It doesn't extend beyond that. So when Indigenous Services Canada receives a request for services or supports for a child, this is a very high level view of like how they need to determine that request, right? And the tribunal has ordered Canada to do this. So they need to look at a request and determine, okay, is it needs-based? Is it in the best interest of the child? Is it needed to provide culturally relevant service provision? Is it needed to ensure substantive equality? And/or is it needed because of the child's distinct community circumstances? For example, many families need to access Jordan's principle for medical transportation, right? In northern or remote communities. And that would be, of course, a distinct community circumstance. So substantive equality is really key to Jordan's principle. And it's also really key just to ensure the rights and dignity of First Nations kids. And so really the tribunal talks about this vis-a-vis the Canadian Human Rights Act. And it's really just an effect or principle of equality, right? And it's really an opportunity. Substantive equality is an opportunity, is to ensure that First Nations kids have an opportunity equal with other individuals to make for themselves lives that they want, right? So it recognizes that we're not starting from an equal playing field, right? It recognizes that that First Nations kids have undergone colonization and ongoing colonization. It recognizes the generational inequities, multi-generational impacts of discriminatory policies and operations like the residential school, like the 60 Scoop, so on and so forth, right? So what are sort of the indicators of substantive equality, right? It's things like First Nations kids staying with their families and communities when possible. As I said, it addresses needs resulting from historical disadvantages. It ensures culturally relevant services, right? So for example, ensuring that First Nations kids have access to ceremonies, have access to language camps, right? Land-based learning, things like this, because we know that culture and language is a key part to ensuring the well-being and best interests of kids, of First Nations kids. And it's really knowing that families and communities can serve, protect, and nurture their kids in ways that honor resilience and self-determination, right? So there's this really excellent report from the Pan American Health Organization called Just Societies. And that's very interesting about this report is it found that like the history and legacy and ongoing colonization alongside other structural drivers really affected the ongoing conditions of daily lives, right, of Indigenous peoples throughout the Americas, right? And it found that access to governance, access to human rights was key to not only addressing those structural drivers, but also ensuring a good quality of daily life, right? So really what it's saying is, equity, so access, equity to services, things like this, and culture, as I said before, was key to ensuring a dignified life for Indigenous peoples. So we have the Caring Society has identified some ongoing concerns with Canada's compliance with the tribunal orders, right? And it's frankly fairly basic things. For example, families not being able to reach anybody at that 24-hour call center and like regional contact centers. Canada not meeting the tribunal order timelines for determining requests. There is unopened requests and backlogs. There's between 40 and 80,000 requests waiting for determination with Indigenous Service Canada right now. We're seeing situations of lack of timely payment for services and reimbursement. So some service providers, in some cases, are no longer able to provide services through Jordan's Principle because of the delay in being reimbursed for services. And we're seeing situations where Canada is denying requests on non-permissible grounds. So for example, Jordan's Principle is not an income support program, or Jordan's Principle doesn't have housing authority, so can't, approve a request for mold remediation in a house, things like this, right? And frankly, we're just seeing a lack of timely and compassionate response to urgent requests, right? And some of these concerns we actually saw from a pediatric study. It's actually some of the folks on this call were part of this study as well. In 2020, the Canadian Pediatric Society did a Jordan's Principle study, and they really were looking into, do Canadian pediatricians access supports and services for First Nations kids through Jordan's Principle, and did a survey of knowledge, behavior, and experiences, right? So there's 265 respondents, and of those, 232 provided medical care for First Nations kids or youth, of which 90% were aware. So there's a lot of really great information that was helpful to see where folks were at in terms of understanding and navigating Jordan's Principle. And so the Pediatric Society, they did an information sheet early in 2024. And so I put the source there for you guys to take a look. And as I understand it, it's going for publication at some point as well. But what I'm going to draw your attention to is one very key thing, is that 28% reported that there was a negative outcome for a patient or family due to a delay in accessing Jordan's Principle, right? Some of these common impacts included developmental and educational, medical complication, worsened mental health, unnecessary separation from the family, delay of therapy, or prolonged hospitalization, right? And so, of course, when we've seen this, when the Caring Society seen this, we're like, oh my goodness, like this is exactly what we wanted to avoid, right? Kids shouldn't have to access and wait for very basic services, right? And when they shouldn't have to wait and experience harm because they are waiting. So in part because of some of what we heard and seen from families, First Nations communities, so on and so forth, we actually filed a non-compliance motion at the Canadian Human Rights Tribunal in December 2023. And so very important, we've been flagging this non-compliance since 2018. For example, part of my job is I monitor Canada's compliance with Jordan's Principle orders. And so we had like a little ongoing concerns document that we called. And it started out as like, I think a 6 or 7 page document, issue, remedies, right? And then that ballooned in 2021 to a 45-page document, right? And so, we were proactively suggesting solutions. We raised these concerns repeatedly. And unfortunately, Canada did not resolve the concerns. And in fact, the severity of harms for First Nations kids grew. So this is a very brief timeline of the process for this non-compliance motion. So as I said, we filed the motion in December 2023. We filed affidavits in January. And in fact, the Caring Society also filed reply affidavits. And one of those affidavits was from Dr. Giroux. a very amazing Métis pediatrician out of Toronto. And it was really helpful to have that his affidavit, because he spoke about the importance of social prescribing. Because one of the issues that we've been seeing with Canada's implementation of Jordan's Principle is they're trying to narrow sort of the scope of Jordan's Principles, in some cases not to include what might be considered social prescribing. So we reached out to some doctors and said, hey, what do you think of this? Is this what do you guys think of this? And so Dr. Drew provided sort of his guidance and expertise on that, which was wonderful. Really what we want to ensure is that Indigenous Services Canada is not overriding the recommendations of pediatricians for their patients, right? And that they are determining those requests based on sort of those tribunal standards that I mentioned, in a manner that, as I said, does not override professional recommendations, right? So we are looking forward to potentially a hearing in August. This may change, but that's what we know currently. And that will be public. All this information as well is publicly available on our website. So if you are interested, please give it a read. So how do we measure progress, right? Like, how do we know that non-discrimination is being achieved? Well, first of all, it lands at the level of kids. And we also don't accept incremental equality, right? So we don't accept things like, okay, well, let's have a discussion about this and we'll get to this in 6 months or a year. Or, we'll put a solution to this problem for 4 years and then we'll look back to it, right? Well, 4 years in a childhood is quite short, and we need some surety, right? So there's other sort of solutions that we put to Indigenous Services Canada, right? We had done a data estimate or a data assessment back in 2021 with the Institute of Fiscal and Social Democracy. And what the data assessment found was that most requests going to Jordan's Principle were actually for low dollar amounts for governments, but of course, very high value items or supports for First Nations kids, right? Majority of requests were actually below $1,000, right? And so we asked the Institute of Fiscal and Social Democracy, like, hey, how much does it actually cost Indigenous Services Canada to determine these requests? Well, they estimated cost them $536 per request. So we're like, perfect. ISC, you should just presumptively approve anything below $500. You'll be saving $36 for those requests that are supported by professional recommendation. The other piece that we're really looking to do is ensure compliance with existing orders, right? We're not going below what's already been ordered by the Human Rights Tribunal, right? The other piece is plugging holes in other unfunded areas through the Spirit Bear Plan, which is adopted by the Assembly of First Nations Chiefs and Assembly in 2017. So this requires costing out of all services and filling the gaps in a time frame sensitive to children's needs, right? And this is so important because when we look at the data from Jordan's Principle, some of the top requested items are things like education-related items, medical transportation, right? Mental health supports, which is not surprising because we know that on-reserve education is deeply underfunded. The Auditor General of Canada has consistently said this. Medical transportation also continues to be underfunded. And we know that access to mental health services is a deep unmet need for First Nations kids, right? Okay, so we ensure that those programs and supports are properly funded and that kids can access them. Then we can turn Jordan's Principle away from just, frankly, shoring up formal equality, right? Because that's what we're doing. Or Indigenous Services Canada is doing with Jordan's Principle. And that way we can turn it towards ensuring the substantive equality rights of First Nations kids. So these are some of the recommendations we put forward. So when we talk about discrimination and ensuring non-discrimination for First Nations, Métis, and Inuit kids, what we're really talking about is accountability. Canada has a very long history about knowing about the harms of First Nations kids and choosing not to do anything about it, right? And so back in 2021, the Caring Society worked alongside the Ottawa-based Indigenous youth group called Assembly of Seven Generations to look at what does accountability look like, right? What kind of mechanisms or bodies do we need to have to ensure non-discrimination, right? So what the young folks said was like, we need to move away from rights promotion towards a mechanism that can actually make binding orders in the government of Canada, because we do not trust that the government will actually, take a report and do something. Because frankly, we've had generations of evidence to know that they will not do that. So some of the indicators of accountability the youth are looking for is the binding. That the body has ability to make binding orders, and that a body or a person or an organization that is working towards non-discrimination, ensuring the rights of First Nations kids has integrity. And so what the young people meant by that was they're able to receive feedback and make changes based on that feedback. They don't get defensive, they accept it, right? The other thing is challenge incremental equality, and also safeguard childhoods now and for generations to come. Young people are very concerned, not just for their own childhoods, but they don't want kids in the next generation to have to go through what they went through, right? So they're very concerned about things like, 11-year funding cycles or 4-year funding cycles. They want surety that in 25 years and 50 years, the government of Canada is not going to backslide. So again, I would really encourage you to check out this amazing report by these young folks to learn all about sort of some of the accountability thoughts that they have for the government of Canada and for others. And so with that, I really thank you for listening to me while I chatted, and I would welcome some questions as well. I'll just stop sharing my screen, and I see there's a couple of chats. Yes. Okay, so can you comment on the simultaneous? Yeah, so it's a great question. So there's the question is, can you comment on the simultaneous existence of Southern medical fostering of First Nations kids from the North and Jordan's principle? It appears to be more common for children from Nunavut, but also occurs with First Nations kids. Yeah, so I mean, this is like Jordan River Anderson, right? Like his parents very much wanted him to live at home in Norway House Cree Nation, but because of underfunding of First Nations communities and generationally, that like it was just absolutely not possible for him to live there, right? So even though he had a very welcome, like loving, caring family, his only option was to live in a foster home, right? And so that absolutely needs to be something that absolutely needs to be addressed. I will also make a note that Jordan's principle is only for First Nations kids. There is like kind of like a cousin program called Inuit Child First Initiative. And so Inuit kids are accessing services and supports through that program. Two things to know about that. ITK, so the Inuit National Organization, oversees Inuit Child First Initiative and Canada's implementation of it. And two, it's not backstopped by tribunal orders, right? So when I talk about like the timelines, for example, while I'm sure the government says we make best efforts to meet those timelines, there isn't a tribunal order compelling them to do that as well.
Thanks, Brittany. I saw also that, and thanks for the presentation. I saw Tom and Radha come on camera, so I'm assuming they have some comments, and it may be about Inuit children as well, but I won't presume. Go ahead, Tom.
Mathews, thank you so much for a terrific presentation. My question really is a segue from Chris Vadebonker's, that my understanding for Nunavut, when I attempted to access these sorts of supports, is to go through the Ombudsman of Nunavut. And as far as I can see, there's no transparency to this. It kind of goes there, and you never really know what happens. Is there any intent or plan to expand Jordan's principle to all Canadian Indigenous children?
Yeah, that's a great question. So certainly I think there's a very unique sort of situation with First Nations kids because of uh, Indian Act, like frankly, a race-based piece of legislation called the Indian Act, right? So there's a fairly unique situation, but at the end of the day, we know that First Nations, Métis, and Inuit do experience discrimination, do experience lack of access to services and frankly, equitable access to services, right? So I know that has and works towards Inuit CF Child First Initiative. Um, as I said, the bad thing about that is it's not backstopped by tribunal orders. And so it's more of a program that can, doesn't necessarily have the same safeguards that Jordan's principle does through the tribunal, right? In terms of Métis kids, as a Métis person, I'm not aware of any Métis Nation governments looking towards implementing or having a similar sort of support for Métis kids like Jordan's principle. I think we're probably going to see like some movement on that because there have been rumblings about a distinction-based health legislation. And I think this is going to sort of bubble up, access to services. But as of right now, I'm not aware of any movement on that front. So
Yeah, I mean, I think it needs to go further. At the end of the day, all children are sacred,
yeah,
and I don't think this is good enough.
yeah, I 100% agree. And you know what? Like yeah, I hear you. It's kind of like a black box and you write to the ombuds person and none of it. But this is where you write. You keep an eye on things like the distinctions-based health legislation. I don't know where it's at right now, frankly, but I have you know, taking a look at that health legislation. Is it sufficient to ensure that First Nations, Métis, and Inuit kids have access to services, right? That's, you guys have expertise in this field. You could take a look at that, write to your members of parliament and say, hey, this is what we need to see as pediatricians, right? For not just First Nations, Métis, and Inuit kids, but all kids, right? Yeah. Sorry, other
Thanks,
question?
Rhonda. Did you have a question?
Just couple of comments and a question. So I did want to make that point just for everyone that Métis children are not eligible for Jordan's principle, and people often forget that. And so ensuring that they receive supports in other ways. Um, and I think I was part of the team that led that study. And one of the things that we also found that I think is important for us pediatricians to know is that there are a lot of individuals who did not know that urgent requests are to be addressed within 12 hours. And, oftentimes, pediatricians are concerned that they will not be able to access services within a timely manner. But I just wanted to encourage pediatricians to access those resources, call those numbers, through our social workers here at CHEO, as well as a new social worker who we have, Sarah Payne, who specifically there to support our Indigenous children and families to be able to try to access Jordan's principle and Child First Initiative. So I just wanted to make that point. And I just also wanted to thank you so much, Brittany, for agreeing to present at Grand Rounds today.
Of course, thank you. Yeah, and that's a great point. Yeah, 12 hours for individual requests the government has, and then 40 hours for group requests, right? As I said, part of the reason I'm going to be very frank with you. Part of the reason why the Caring Society filed that non-compliance motion is because Indigenous Services Canada is meeting those timelines less than 50% of the time by their own data, which is very concerning because in some cases, the Caring Society has actually had to step in to stabilize a child, right? Make sure that their urgent needs are being met. In some cases, the community's had to do that. In some cases, thankfully, a hospital has been able to do that, things like this. But that shouldn't happen, right? And so, yes, they have 12 hours to determine a request. But if they actually need to immediately sort of meet the urgent needs of the child, right? Especially if it looks like they're going to go beyond that 12 hours. So the 24-hour call center is your friend. The regional contact centers are your friends. And community-based service coordinators. And as Dr. Jetty mentioned, you guys have a great team of social workers as well.
Thanks, Brittany. Sheila, I saw you put a note in the chat, and I think it's actually quite important. Do you want to speak to that for a sec? And if not, I can read out your chat. You also may have stepped away. So
sure, no, I can do that. I just had a trouble unmuting myself. Yeah, so one of the things, of course, is worrying about children who fall through the cracks because they don't know, or the parents are reluctant to disclose that they are First Nations, right? For fear of discrimination, which of course we know happens in different settings. And so, we are moving to collect patient sociodemographic data, but until that time, it's very difficult, right, to know who is First Nations if they don't disclose it. So we are, looking at, possibilities of active offer, right, saying, if you do identify as First Nations, Inuit or Métis, there are a number of services and supports we offer. If you're First Nations, we can support you for Jordan's Principle or whatever. But any comments around that, or any thoughts around self-disclosure?
Yeah, I think that's so important. And I'm glad that you guys are sort of moving towards the active offer. The name is on the tip of my tongue, but the province of Quebec did this amazing sort of commission. I think it's the Vienne Commission. I take a look at that commission. They might like VIENS. They might have some really great ideas, guidance, recommendations, things like this. I think there's definitely, like, frankly and unfortunately, there is a history of First Nations, Métis, and Inuit people not being treated with respect in hospitals and other sort of institutions. So the first step, of course, is recognizing, acknowledging that, and taking proactive measures to ensure that, when First Nations, Métis, and Inuit folks come into hospitals and other institutions, they're, know that and there's some surety that they will be treated with respect and dignity. And I think this is also potentially where that accountability piece comes in, looking at sort of not just sort of the indicators of accountability that the youth put forward, but also potentially, seeing it as guidance for the hospital and other institutions that they can do to ensure that, they're addressing sort of the legacy, but also ongoing sort of concerns of First Nations, Métis, and Inuit folks. And it's really about, I think in some cases, building respect and relationships in communities, and with individuals, but also proactively disclosing what they can do or what the options are if there's any concerns, right? And having folks on standby who can help folks, First Nation, Métis, and Inuit folks, navigate hospitals as well, right? Which I'm sure you guys are already doing. I'm not like saying you're not, but these are just some suggestions that you can look to, and those two reports, the Vienne Commission and that accountability report that I mentioned, I think can be sort of a jumping off point, as well, if you want to take a look at those. That's a great question. Thank you.
Yeah, thanks. And Mylène Poitras posted information on the Vienne Commission report in the chat, so people can access that there if they want. And I think this discussion is just demonstrating again the sort of the overlapping nature of barriers to access to care, and especially in this context. I had a couple of maybe more prosaic or pragmatic questions. One is I'm curious about the reasons for denial. And I have the Caring Society website information sheet on Jordan's Principle, and it's kind of as I
understood it was, when services are requested, the government of first contact pays for the service and can resolve any jurisdictional or payment disputes later. So to me, I always thought that was a very simple statement. And that, any disputes would be resolved on appeal. So in terms of denials, is that kind of administrative? Is it an eligibility denial, or what are the reasons for denial?
Yeah, so the reasons for the denial can be things like, that the government has determined that Indigenous Service Canada has determined that a service is not needed for a child. It's not in their best interest. It's not needed for substantive equality, things like this, right? In some cases, they'll deny it because the child is not eligible. So for example, Jordan's principle is only up to the age of majority, right? Certainly there's, an argument to be made post-majority, but anyways, so there is some eligibility denials, but I would say 9 times out of 10, in my experience anyways, it's things like, you'll see a denial rationale like, it's not clear what the unmet need is, the letter of support from the professional or elder does not address the needs of the child or like what they actually need, things like this, right? So it is administrative, and like sometimes families will reach out to the caring side being like, what does this mean? Because it can be very bureaucratic language. So this is part of the reason, for the work, your guys' work is there does need to be a letter of recommendation. And so for yous, if you guys are recommending a service or support for a child, being very clear what that is and why the kid needs it. And in some cases, you kind of have to say like what will happen if the child does not have access to the service, right? That's important. And the Caring Society, in some cases, Indigenous Service Canada will deny things in the Caring Society's view as outside of sort of the tribunal orders, and not in a manner that's not consistent with the tribunal orders. So they'll rely on sort of their own administrative concerns, right? So things like it's outside of our program authorities or outside of financial authorities, things like this. But the problem with that is they're not actually addressing the needs of the child. So for example, in the last few months, we've had a lot of families and communities reach out to the Caring Society because they've made a request to Jordan's principle for mold remediation in their homes. So as you guys may know, particularly for on-reserve homes, generations of underfunding of housing and adequate access to housing has resulted in poor housing in communities. So it's quite common for that to happen. And ISC will deny it. Even though, for example, there's a letter from a pediatrician saying, hey, this child's asthma is getting very serious because of the mold, right? Things like this. And they'll deny it for reasonings like it's outside of our program authorities. And so this is part of the reason why we're at the tribunal right now, is because we don't view this as consistent with the tribunal orders. So for you guys, once you receive a denial, the next step is you can place an appeal. And the appeal goes to an external experts committee. And that committee is comprised of professionals like a social work. I'm trying to remember who's on it. So a social worker, a pharmacist, a dentist. I think there actually might be a pediatrician on there. Folks like this, and they will look at a request and determine based on their make a recommendation to Indigenous Service Canada as to what the decision should be. So should they overturn the denial or should they keep the denial, right? Again, they make their recommendation to Indigenous Services Canada, right? So it's not clear to me if ISC will keep that recommendation or not, right? So anyways, note for you guys, actually, keep an eye out because I think there's actually a request for proposals for folks to be on this committee as well. And so certainly, I think it's really important that there are experts who have knowledge and understanding of the intricacies of First Nations kids accessing services and things like this, right? So that's up your alley. You might be interested in doing that work. I think you're on mute.
I muted myself.
Yeah.
Yeah, so thanks. Anyone else on the call have any questions or comments? I did have just one more, which was you brought up the age of majority, and if I think about pediatric care, there's a lot of conditions, a lot of medical conditions that don't magically disappear at 18. And in terms of transition for supports that were initiated under Jordan's principle, what happens to those supports after the age of 18? Again, in our world, the transition's a big thing, and things don't just magically disappear.
Yeah, that's a great question. It's something that I know, for example, the Assembly of First Nations and other First Nations across Canada have been very concerned with. Of course, the Caring Society is as well. The long and short of it is in 2022, the tribunal would order Canada to assess what sort of supports would it look like for them to do post-majority Jordan's principle work, essentially, right? So at this point, Indigenous Service Canada position is that at most they will do what's called service navigation for young people as they age out of Jordan's principle, right? But I can tell you, like in my experience and my knowledge, that as you said, those needs are still there, and also particularly for young people who live on reserve and for young people who have disabilities or have complex medical needs or whatever it might be, there's very often nothing for them to access on reserve, right? So it can be actually really a difficult situation for families. What I can say is, you can certainly work with Indigenous Services Canada to, in some cases, ISC will extend for a very short time services so that past the age of majority, so that it gives time for the family and the circle of care to sort of put in other services in the meantime. So there is that, but there's nothing sort of compelling Canada to do that at this point. As I said, there is work to try to get that extended or get sort of other supports in place, as I said, particularly for those medically high medical needs young people. In terms of the service coordination part that ISC was looking into, certainly it's the Caring Society's view that is like not sufficient. And also, I'm not aware. It's my understanding they actually have not even implemented that yet. So, work is ongoing. Yeah.
Hey, thanks, Brittany.
Of course.
I saw Nancy come on camera. I don't know if she wanted to make a comment, and maybe we'll give last word to Nancy if she does.
Sure. Thank you, Brittany. Wonderful presentation, really important. I think a lot of what we're hearing is that the Caring Society has done some great work, and there are more options for First Nations children and youth, but what everybody on the call is wanting is more. How do we expand this to older youth? How do we expand this to Inuit and Métis? And how do we expand beyond the money, which I know is a huge question, but you can put all the money you want in some of the First Nations and they still won't have the professionals to deliver the services. So I encourage you to keep going and keep broadening, and really applaud you for the work you've been doing. Thank you.
Thank you. No, that's a really good point. And I think this is where we look to for example, the direction of young people. They very clearly not just want accountability to ensure non-discrimination for themselves, for this generation from the Canadian government, but also accountability from their own communities to ensure that First Nations, Métis, Inuit communities and organizations are meeting their rights, as young people. And certainly when it comes to Jordan's principle, we've been able to move the meter stick forward because First Nations communities have led that work. And families have led that work. In some cases, also pediatricians like yourselves have, right? So thank you for that.
Hey. Well, on that note, I think we'll thank you again, Brittany, for joining us and for a provocative and informative grand rounds. And just on signing off, just for me an administrative thing, but if anyone was planning to join our virtual pediatric update, it's this Saturday, and you can sign up until Friday afternoon. So again, thank you everyone for joining. Thank you for Brittany for the presentation and everyone who participated in the conversation. Okay,
Thanks,
bye.
everybody. Bye.